Hi, I'm Dr. Jeff Forzley with Lemont Natural Healthcare. I am board certified in integrative medicine and I am a chiropractic physician. I've been in practice for over 30 years and I have 1,000 plus postdoctoral credit hours in holistic therapy. This includes balancing the digestive system, the immune system, hormones, and diet and nutrition. I work with Dr. Matthew Imber, who is our neurological specialist. He is board certified in functional neurology. We'd like to welcome you to our educational series regarding chronic health conditions. Enjoy the presentation. Welcome to Lemont Natural Healthcare's Advanced Thyroid Recovery Program that will address the cause of your condition with comprehensive lab tests using a natural, holistic approach. Are you suffering with a thyroid condition? Are you confused and frustrated due to persistent thyroid symptoms despite your current treatment program? Do you have thyroid symptoms but have been undiagnosed or misdiagnosed? Are your lab tests normal but you have all the thyroid symptoms? Have you been told to just live with it? If so, let's talk about our thyroid recovery program. Now let's talk about our goals in helping you with your thyroid condition. Number one, a proper diagnosis. Number two, we want to provide symptom relief, but just as important, we need to find and manage the underlying cause or multiple causes of your thyroid condition. We need to decrease inflammation, as it is the underlying factor in most chronic health conditions. We need to detoxify the body, the gut, liver, and kidneys. However, beware that if you have a weak immune system or if you have an autoimmune condition and you detox the body and your body is not prepared for that, it can make you much worse. We need to improve the immune system. So how do we do this? First of all, proper testing. And for most of my patients, this is more extensive testing than they previously had done. Two, we need to identify and eliminate food allergies and sensitivities as they weaken the immune system. We need to heal the gut. 80% of your immune system is in your gut. We need to balance blood sugar as it is the #1 body stressor. We will balance body pH, identify and eliminate toxins, increase energy production, balance the adrenal glands or the stress response, as they have a negative effect on the thyroid and will slow down thyroid healing if they are out of balance. We need to identify heavy metals. We need to identify genetic tendencies and balance the nervous system. Now, holistic therapy says we're going to look at all the systems of the body and how they interact together. The nervous system is going to balance all of those systems. So we look at the gastrointestinal system, the immune system, and the endocrine system and realize that balancing the nervous system aids the healing in all of those systems as well. Thyroid functions. The thyroid hormone controls body metabolism. It's associated with energy, body weight, digestion, bone formation, balancing blood sugar, mood, detoxification, liver and gallbladder function, stress hormones, and the stress response. Every cell in your body has thyroid receptors. When your thyroid hormone levels are out of balance, it affects your entire body and all the cells of your body. There are three major thyroid conditions: hypothyroid, hyperthyroid or Graves' disease, and Hashimotos Thyroiditis. Now let's go into detail for all three of these conditions. Let's take a look at hypothyroid first. This is low thyroid hormone levels. Symptoms can include fatigue, weight gain, poor mental focus, concentration and memory, depression and mood disorders, poor digestion including bloating, gas, constipation, gastric reflux and indigestion, thinning hair, dry skin, a cold intolerance or cold extremities, insomnia, unrefreshed sleep, and hypothyroidism can be autoimmune. So what you think of when you have low thyroid hormone levels is, since it controls metabolism, everything slows down. So when your metabolism slows, you can have fatigue and weight gain, poor mental focus, poor brain function, poor intestinal function, so you get constipation, you feel cold because your metabolism is low. Next is Graves' disease or hyperthyroidism. So these are high thyroid hormone levels. Symptoms can include increased pulse rate, even at rest, heart palpitations, inner trembling, emotional and nervous, insomnia or night sweats, difficulty gaining weight, exophthalmos or protruding eyes. This is an autoimmune condition 100% of the time. And finally, Hashimotos Thyroiditis. These are alternating high and low levels of thyroid hormone, thus a combination of the high and low thyroid symptoms we just talked about. This is an autoimmune condition 100% of the time. Hashimoto's also is the most common autoimmune condition. Have you been told your lab tests are normal, but you still have thyroid symptoms? This is very common in my practice. This is called euthyroid, and what this means is you have the thyroid symptoms, your thyroid gland is not producing enough thyroid hormone, but your lab tests are within the medical ranges. Now, there is a difference between what we call medical ranges and functional ranges. Medical ranges are much wider, functional ranges are more narrow, and the functional ranges are based on an absolute ideal situation, which is where you would like your ranges to be. When you're out of the functional ranges, it's kind of like the warning light coming on in your car. Now, for example, TSH or thyroid stimulating hormone, the medical range is usually 0.4 to 5.0. The TSH functional range is 1.8 to 3.0, so you can see there's a big difference there. And also there's varying levels of hormones through different periods of time, and it's a matter of the timing of the test. So Hashimoto's varies from highs to low hormone levels. So if you take the test today, it might be normal. You take it in a month, it might be high or low. Let's talk about thyroid patterns. There are 8 major thyroid patterns and 24 overall thyroid patterns. We must determine which patterns you fit into in order to manage your thyroid condition properly. So we run a 10-panel thyroid test to determine what patterns you fit into. Most of my patients come into my office with only TSH or T3 or T4. That is not enough to determine which patterns you fit into. And again, we need to know how many of these patterns you fit into in order to manage your case properly. And as a side note, thyroid medications only help one of these patterns. So if you do not feel good while taking thyroid medication and it does not improve your thyroid symptoms, it's most likely because there are other thyroid patterns that are out of balance and need to be addressed. So how do we determine your thyroid pattern or multiple patterns? By proper testing. So we are going to run a full chemistry panel that involves 49 tests. Part of these 49 tests is our full 10-panel thyroid test. And this will help us determine the patterns that you fit into. Our chemistry panel also includes testing for cholesterol, which cholesterol is very commonly high with low thyroid levels because thyroid helps to break down cholesterol. So if your thyroid levels are low, your cholesterol tends to run higher. Chemistry panel also includes testing for anemias, blood sugar imbalances, inflammatory markers, gastrointestinal markers, and proteins, liver enzymes. There's 49 tests overall. We will also test your saliva hormones. There is an interaction between all of your hormones, including the stress hormones, cortisol, and the thyroid. We will run a stool analysis for gut infections. If you have gut infections such as parasites, bacterial, and yeast, it will weaken your immune system. And remember, 80% of your immune system is in your gut, and most thyroid conditions are autoimmune. We will run an intestinal permeability or leaky gut test. Leaky gut is the precursor for autoimmune conditions, and most thyroid cases are autoimmune. We will run food allergy and sensitivity testing. If you are eating foods that you have a sensitivity to, then this will run your immune system down and be a major factor in autoimmune conditions. Toxic substances and heavy metals, these weaken the immune system as well as directly attacking your thyroid. Nutritional deficiency testing. Magnesium, zinc is very important for the immune system. Selenium is involved with thyroid hormone production. Organic acid testing for energy production. And genetic testing to determine any predispositions to health conditions, including thyroid. The nervous system and the brain. Your brain makes up 3% of your body weight but consumes 20 to 30% of your body's energy or metabolism. So abnormal metabolism such as thyroid imbalances, blood sugar imbalances, and abnormalities in nutrition can lead to abnormal brain function. And again, your brain directly controls your thyroid, digestion, and your immune system. Your brain controls all the cells, including thyroid and gastrointestinal system. 80% of your immune system is in your gut, and most thyroid conditions are autoimmune. This is why we manage you metabolically and neurologically. Let's talk about how the brain controls your thyroid gland and the release of thyroid hormone. Part of the brain called the hypothalamus controls the pituitary gland. The pituitary gland in turn is going to control all the glands in the body that release hormones. The thyroid releases thyroid hormone. The adrenal glands release cortisol, which is your stress response. The pancreas releases insulin to balance blood sugar. The gonads release estrogen and testosterone. The pineal gland releases melatonin to aid in sleep. And all of these glands also chemically communicate with each other. So it's very important to not only test the thyroid, but test all the other hormones because there is an interaction between all of these glands. One example of this is if your cortisol is out of balance due to high stress, which most of my patients are under, then the thyroid gland will have a difficult time healing if the cortisol is out of balance. So it's important that we determine if cortisol is out of balance and heal the cortisol, balance the cortisol levels for optimal thyroid relief. Let's talk about the thyroid production pathway. It all starts in the brain. The part of the brain called the hypothalamus releases a chemical called TRH, or thyroid releasing hormone, which stimulates the pituitary gland to release TSH, or thyroid stimulating hormone. TSH in turn is going to communicate with the thyroid gland to produce thyroid hormones. This works together with TPO, or thyroid peroxidase, iodine, and tyrosine to make thyroid hormone. There are two different types of thyroid hormone, T3 and T4. T3 is the active form, T4 is the inactive form. 93% of what your thyroid makes is T4. T4 in turn must be converted into T3. 80% of this conversion occurs in the liver and the gut. So if you have any type of digestive problem or liver problem, you're not converting T4 to T3. This is one of the 8 major thyroid patterns that we talked about. Then you have a protein called TBG, or thyroid binding globulin, which carries T3 to the receptor sites in your body for the absorption and use of thyroid hormone. Let's talk about the role your digestive system plays in your thyroid condition. We're going to start with leaky gut syndrome. This is a degeneration of the lining of the gut. This increases gut permeability and allows toxins into the bloodstream from your digestive system. These toxins can be parasites, bacteria, yeast, and undigested food particles. So once these toxins get into the bloodstream, it leads to an immune reaction by your own body. And this leads to autoimmune conditions such as Hashimotos and Graves' disease. Now, leaky gut syndrome is the precursor to autoimmune conditions. It is what starts first, and it leads to all autoimmune conditions. So it's imperative that leaky gut syndrome not only gets diagnosed properly, but managed and healed properly. So poor digestion leads to brain inflammation, and then the brain cannot signal your thyroid to produce thyroid hormone properly. Thyroid and the immune system. Most thyroid conditions are actually primary autoimmune conditions. This means that your immune system is actually the cause of your thyroid imbalance, and the immune system must be managed in order to get optimal thyroid symptom relief. You may never get better with your thyroid condition if your immune system is not managed if you have Graves' or Hashimoto's disease. The immune system. So Th1 and Th2 make up the frontline defense of your immune system. Th1 is your white blood cells. Th2 is your humoral response, or the chemicals that tag the antigens, the viruses and the bacteria, and that tells your white blood cells to attack them. Your Th3 is your T regulatory cells, and they regulate Th1 and 2. Vitamin D is very important in the regulation of Th3. When Th1, 2, and 3 weaken over time, Th17 activates, and Th17 will then increase INOS, or inducible nitric oxide synthase, which causes the tissue destruction associated with autoimmune conditions. Let's talk about autoimmune thyroid. Your immune system is supposed to protect you. So when your immune system actually starts attacking your own body, something is out of balance. When your immune system attacks your thyroid gland, we call this Hashimoto's or Graves' disease. Why would this happen? Number one, toxins. Food preservatives, heavy metals like lead, mercury, or aluminum. Environmental toxins in our air, food, water, and personal care products. Chronic infections in the gut, dental infections, and chronic sinusitis. Also stress. When we're under stress, we release cortisol. Cortisol breaks down the gut and leads to leaky gut, which leads to autoimmune imbalances. Stress also releases high cortisol that can inflame or break down nerve cells in the brain, and then the brain cannot signal the thyroid properly. Inflammation. Poor diet leads to inflammation, and inflammation is the underlying cause of most chronic health conditions. A poor diet, so the standard American diet, it leads to inflammation, blood sugar imbalance, which is a number one stressor on the body, food sensitivities, chemicals, preservatives in our food. Iron in flour actually clogs the liver and prevents the absorption of tyrosine, which helps make thyroid hormone with iodine. Now, the rates of chronic diseases, including thyroid conditions, have just skyrocketed over the years. None of the chronic conditions are on the decline. So we look at cancer, heart attack, strokes, diabetes. We look at irritable bowel, all the digestive conditions, thyroid, MS, lupus, autism, attention deficit. All of these conditions are on the rise, and this is mainly due to a stress in the immune system as well as genetic predispositions. Now, leaky gut syndrome, a breakdown of the gut, leads to autoimmunity and food allergies and sensitivities. If you are putting something in your body in the form of food every day that you're having an immune reaction to, this is going to break down your immune system over time. Autoimmune thyroid. If you have an autoimmune thyroid condition and the immune system is not addressed, you may never get better, and you can develop many other autoimmune conditions, such as rheumatoid arthritis, lupus, MS. If you don't balance the core problem, which is your immune system, not your thyroid, and if you don't balance the attack on your thyroid tissue, then why would your immune system stop at just attacking the thyroid? The answer is it won't. Now let's talk about medical versus holistic therapy for thyroid conditions. Medical has been the same treatment for the past 40 years. It's if you have hypothyroidism, you get thyroid medication or thyroid replacement hormone. such as Synthroid and others. Graves, you're going to get methimazole, which basically is going to block the production of thyroid hormone. And if you have Graves' disease, you really need to be on this medication at first, because you can go into what's called a cardiac storm and put tremendous stress on your heart. Surgical removal of the thyroid, as well as radiation to basically kill your thyroid and then put you on medication the rest of your life. Hashimoto's is, again, Synthroid is very commonly given. It's just thyroid replacement hormone, but it does nothing to address your immune system. If your medical doctor does address your immune system, he's going to give you immunosuppressant drugs, Enbrel, Remicade, cortisone, prednisone. These suppress the immune system, and they can lead to chronic infections and possibly cancer. And it really, by weakening your system, what you need to do is strengthen your immune system when you have an autoimmune condition. Now, holistic therapy is about finding the cause, so proper testing, managing the underlying imbalances such as food allergies, inflammation, heavy metal toxicity, whatever the lab tests show us, and use natural remedies that work with the body to get you better. Now, let's talk about the thyroid hormones that are given for hypothyroidism. Synthroid, levothyroid, and Levoxyl are synthetic thyroid hormones. They're T4 only. There are two different types of thyroid hormones that your body makes, T3 and T4. T4 is the inactive form, T3 is the active form. Cytomel is synthetic thyroid hormone, and this is T3 only. Thyrolar is synthetic thyroid hormone. It includes both T3 and T4. But these are all synthetic forms of the thyroid hormone. Now, Armour Thyroid and Nature-Throid and Westroid are bioidentical thyroid hormones, and they include both T3 and T4. Medical treatment for autoimmune thyroid, including Hashimotos Thyroiditis. Thyroid hormones are prescribed. They may or may not help your symptoms, but they do nothing to address your immune imbalance, which is the real cause of your Hashimoto's condition. Immunosuppressants like Enbrel, Remicade, Humira, and glucocorticoids, these drugs suppress or shut down your immune system. You need a stronger, balanced immune system if you have Hashimoto's thyroiditis, not a weaker immune system. Side effects of these medications include increased susceptibility to infections and decreased cancer surveillance. Yes, you are prone to infections and cancer on these medications. Medical treatment for Graves' disease. Methimazole and propylthiouracil, they interfere with the thyroid's use of iodine. They prevent the production of thyroid hormone. This is necessary to take to prevent cardiac storm, but it does not address the underlying immune system imbalance. Radioactive iodine therapy destroys the thyroid cells that make thyroid hormone, but it does not address the underlying immune system imbalance. Immunosuppressants like Enbrel, Remicade, and Humira, and glucocorticoids, these drugs suppress and shut down your immune system, which again, you need a stronger balanced immune system if you have Hashimoto's thyroiditis. Side effects include an increased susceptibility to infections and a decreased cancer surveillance. Again, you are prone to infections and cancer on these medications. Other treatments include methotrexate, interferons, which again have more side effects. And finally, surgical removal of all or part of the thyroid gland, resulting in a lifetime of trying to regulate thyroid hormones with medication, which can be very difficult. Now, what makes us unique at Lemont Natural Healthcare in treating thyroid conditions is more extensive lab testing to find your thyroid pattern, diagnosis of autoimmune. Some people have proper diagnosis and some people do not, and finding the underlying cause or multiple causes. Neurometabolic therapy, which is managing you neurologically, since your brain controls the thyroid gland and the release of thyroid hormone. The brain controls the gastrointestinal system. Most thyroid conditions are autoimmune. 80% of your immune system is in your gut, and the brain directly controls your immune system as well. And we're going to manage you metabolically, so we're going to work on the immune system, digestive system, hormones, cortisol, insulin to balance blood sugar, and diet, what you should or should not eat, balance body pH, and detoxifying the body. We're going to use natural solutions that work with your body. Now, these are all the factors that we take into account when we look at your thyroid condition. If you look at this list, you can see this is much more involved than just taking Synthroid and returning in 6 months. We're going to evaluate the brain because it controls your thyroid through the hypothalamus and the pituitary gland. Hormone interactions, as we talked about, all the hormones chemically interact with each other. When one is off, the others can be out of balance. We're going to look at your immune system, chronic infections including parasites, yeast, bacterial, and viruses, the digestive system and leaky gut syndrome, dysbiosis or abnormal bacteria in the gut. We're going to look at diet, food allergies and sensitivities including gluten, goitrogens, which are foods that prevent the production of thyroid hormone, tyrosine and iodine, which come together to actually make thyroid hormone, vitamin D, calcium, and magnesium. They're involved. Vitamin D is involved in strengthening the immune system. Glutathione, selenium, which is involved in thyroid hormone production, neurotransmitters such as serotonin and dopamine. You can have altered mood with thyroid imbalances. Toxins. We're going to look at the liver. Most thyroid conditions are autoimmune, and autoimmune patients commonly have a liver that needs to be detoxified. Medications and their side effects we'll evaluate. We'll look at birth control pill. It can interfere with thyroid production. Inflammation, gut inflammation leads to brain inflammation, which again leads to gut inflammation, and the vicious cycle goes on and on. All of these factors must be addressed in order to get optimal results with thyroid conditions. We evaluate all of these factors. So let's summarize. We started with just the thyroid gland and thyroid hormones, but we've added the digestive system, the immune system, autoimmunity, toxins, neurological system in the brain, nutrition, diet, food allergies, and sensitivities. We will integrate the function of the immune system, nervous system, endocrine system, gastrointestinal system, nutritional needs, detoxification, and balance the body with natural remedies. There are 3 commitments involved in our thyroid recovery program. Number 1 are lifestyle changes such as dietary changes, exercise, and getting more rest and sleep. Number 2, time. You will be coming into our office for therapy appointments. And number 3, there is a financial commitment on your part. Your insurance company may pay for some of our program, and we will discuss the cost details at your first appointment. If your thyroid condition is preventing you from participating in the activities you love, and you don't want to live the rest of your life feeling this bad, and your current treatment is not effective, we want you to know there is hope. Let's talk about some thyroid cases, people that we have managed in our clinic. First is a 55-year-old female with hypothyroidism. Her complaints included fatigue, weight gain, hair loss, dry skin, bloating, constipation, gastric reflux, and poor sleep. Our lab tests and examination revealed high liver enzymes, high cholesterol, low vitamin D, thyroid hormone imbalances, gastrointestinal infections in the form of parasites, abnormal stress hormone responses in the form of cortisol, food sensitivities including gluten and dairy, and abnormal neurological findings. The brain was not communicating with the thyroid properly. The results with her thyroid condition through our thyroid recovery program was a 90% improvement in fatigue. She had lost 26 pounds. Hair loss was 95% improved, dry skin 100% improved, bloating 100% improved, constipation 100% improved, gastric reflux 100% improved, poor sleep improved 90%, and her liver enzymes all decreased, telling us that her liver function was better, improving her immune system as well as the processing of all hormones. Next is a 24-year-old female with Graves' disease. Her symptoms include heart palpitations, rapid heart rate, insomnia, anxiety, nausea, lightheadedness, and digestive bloating. Our lab tests and examination revealed abnormal thyroid markers, iron imbalance, leaky gut syndrome, low iodine. Remember, iodine and tyrosine come together to form thyroid hormone. Multiple food sensitivities, including gluten, gut infections, parasites and bacterial, abnormal female hormones, abnormal mineral levels, and abnormal neurological findings. Again, this is the unique thing about our program. We're one of the very few clinics in the state of Illinois that are going to add neurological therapy to your thyroid recovery program. Your brain directly controls your thyroid release. And the results are anxiety, she improved 95%, bloating improved 95%, nausea improved 100%, her sleep improved 95%. And currently she has mild periodic heart palpitations, rapid heart rate, and lightheadedness. She did very well on our program.
Hi, my name is Sue. What brought me here about 8 weeks ago was first I had a thyroid disorder. I have Hashimotos. I had extreme fatigue. By the end of the day, it was difficult to walk up and down the stairs, even just to finish my day. I had a lot of pain on the right side of my body. I was taking ibuprofen probably 3 or 4 times a day. And also I had some hair loss, I had some weight gain, and a lot of difficulty losing that excess weight, even with some good diets that I thought were good diets. Since I've come here, started the dietary changes, the neurological physiotherapy, I feel 100% better. I have absolutely no pain whatsoever. I can get up from a chair. I can start walking right away. I actually have no discomfort whatsoever. The fatigue is gone. I'm tired maybe by the end of the day, as everyone is, but there's no more physical fatigue left. It's gone. I feel 100% better. I've dropped about 17 pounds in 8 weeks. And I'm thrilled with my progress.
So you've just seen how effective our thyroid recovery program is, and what we're going to do is offer you a free 30-minute phone consultation, and the purpose of this is for you to ask specific questions about our program and to allow us to talk about your thyroid condition. You can reach us at 630-257-0550. We look forward to helping you with your thyroid conditions. Have a great day.